Hello, I am Sarah Breckville and welcome to Power of the Patient Project. Today I am with Dr. Anthony Wehbe. He is the Chief Population Health Executive of Jefferson Health, New Jersey, and we have a special conversation today talking about the role of a hospitalist, correct?
Yes.
So just to start with, how about you explain to me what exactly is a hospitalist?
Sure. So a hospitalist is a certified physician that practices in the confines of the hospital. So they don't have an outpatient practice. They really practice inside the four walls of the hospital. So if someone comes into the hospital, gets admitted, for example, if they have a stroke or a heart attack through the emergency room, then the hospitalist takes care of that patient until the patient goes home or goes to a rehab center. The hospitalist is usually a board-certified physician, or it could be a nurse practitioner as well. For the most part, they are board-certified in internal medicine or family practice, or could be one of the specialists like a kidney doctor or a cardiologist that's practicing as a hospitalist. So really the hospitalist practice is within the hospital and they act as a general practitioner. So what I tell my patients is a hospitalist is like your family doctor on the outside, but all we do is practice in the hospital. So
Okay.
patients can relate to that sort of concept.
Okay, well, and now that you said that, describe for me the process for when a patient is admitted to the hospital by his or her primary care physician,
Yes.
and then a hospitalist takes over for that patient's care. Kind of run me through that process.
Sure. So when the patient comes in to the emergency room is usually when the hospitalist, he or she, takes over the care. So the patient comes in, whether they have a stroke, a heart attack, an infection, then the hospitalist usually goes down to the emergency room, sees the patient, goes over their chart, their records, their labs, all the testing that were done, and then kind of make sure that they're on their home medications that they were on. They should be reconciling the medications with their home medications, because sometimes you have to stop certain medications if depending on the condition that they're on. Sometimes you continue medications, and that gets very frustrating for patients a lot of times because they're so used to taking their medications. At 7:30 I take this medicine every day. It could be, for example, a water pill. But if you have an infection or a heart attack, we have to stop that water pill because it could be detrimental within that infection or scenario. The hospitalist should be communicating with the family doctor if it's something complicated. Now, that doesn't happen all the time, but that's why it's an advantage if you're within a health system. So, for example, at Jefferson, if you have a Jefferson family doctor on the outside, the doctor's inside the hospitalist, he or she is a Jefferson doctor. We're all on the same computer system, so I know what medicines you're taking at home with your family doctor. I can see them here, because a lot of times patients don't know or remember the medicines that they're on, and that is a big problem. So if it's 1 o'clock in the morning, a patient had a heart attack or a stroke, and it's hard to call the pharmacy, get the medications from home if they came by ambulance. So that's really the process, and then the patient comes and gets admitted to the hospital, they get treated, and then discharged to home or to rehab. But that hospitalist acts as your main doctor throughout the patient's stay in the hospital.
Now, going off of that, I think a lot of patients, especially patients that we talk to who are in the older population, they get a little aggravated or kind of upset when their primary care physician isn't seeing them in the hospital, isn't handling their care. The hospitalist is doing that. And obviously you described that role, but kind of talk to me about why these patients maybe shouldn't be feeling this way.
Sure.
Is there any way you can put their mind at ease?
Yeah, sure. So the hospitalist specialty, I'd say, is fairly recent. In about the last 20 years is when the specialty really flourished. There's been a lot of pressure on family doctors or primary care doctors on the outside to care for patients, and it's hard for them to go back and forth between the hospital to their office, and it's put a lot of pressure on the outcomes of care. So what we've found is by having a doctor, the hospitalist, he or she in the hospital, In a lot of places like Jefferson, we have 24/7 hospitalists. So if you need someone there at the bedside at 2 a.m., you have a hospitalist there. It's hard for your family doctor to come out at 2 a.m. They would usually see you once in 24 hours. The hospitalist is in-house. If there's an issue with the cardiologist, the heart doctor, they can talk to the cardiologist there. So it's become very challenging for the family doctor on the outside to kind of play both roles. I think the key here is obviously putting patient safety always first, and making sure you're communicating with the family doctor on the outpatient side. So it's become very hard for doctors to do both, even for hospitalists to practice on the outside. So everything has become so specialized now because we've seen better outcomes of care with the model that we have now.
Okay. And you talked about the hospitalist role before, but tell me a little bit about, how have they been trained to deal with patients when it comes to advocating for patient rights, understanding their patient rights, when a patient is in the hospital?
Sure. So when a physician or a hospitalist joins the system or practices in the hospital makes sure they go through an onboarding process, a training process. So it's part of your joining a health system. And then every year, a health system has what's called the annual mandatory education. So every physician, he or she has to go through this module and read about patient rights. We also have accessible within the hospital case managers and social workers that are very well versed in patient rights as a resource. But physicians go through annual training for patient rights, and they should be patient advocates, obviously.
Okay. Now, another question, backtracking to when you're in a hospital, many patients don't expect them to go to a hospital. They don't want to. That's not a fun process. No. But when they're there, how can they make it a better experience? Is there a way that they can prepare to have a more positive experience? Obviously, that's tough when you're in a hospital.
Sure.
But anything that comes to mind for you?
Yeah, no, of course. I tell my patients, although I love seeing you, you don't want to see me as your doctor, because that means you're in the hospital, whether you came in via an ambulance or your family member dropped you off. No one plans to go to the hospital. It's not like, you're giving, when my wife had a baby, we had the bags ready and we were ready to go to the hospital. This is a very much different scenario. When that happens, what I tell patients is to write everything down. I think it's to be in that moment, have a pen and paper. It's very important, and to facilitate the communication between the caregivers, whether it's a nurse, a doctor, a pharmacist, a specialist, a hospitalist, is to really write everything down. And what we do at Jefferson is we actually provide the patients with these notes and information and communicate to them. So they all have boards in their rooms, in front of their beds. We make sure we write things down. I give them a big card that says hospitalist, and I tell them I'm your main doctor. We all have cell phones. So all the hospitals, the advantage of being in hospitals, you're always in-house. So a typical hospitalist works shift work. So I'll work 7 a.m. to 7 p.m. I'm always in-house. Then the next shift comes in 7 p.m. to 7 a.m. And you always have accessibility to that doctor. So I think communication with your team, now it's more really team and not just the doctor, the hospitalist caring for you. You have the pharmacist, social worker, case managers, the nurses. So I think writing everything down I found to be very helpful for patients, and communicating. If you have a family member there that can help write these things down for you, is very helpful. Because when you're a patient, that's the last thing you also want to, you're not really thinking straight, you're really worried, and in a different state of mind. So I think having a family member there, and then also writing things down, communicating.
And just to kind of dig deeper into that, why is it so important to write it down, to communicate? Because generally I'm thinking when I go to the doctor, I just, I listen and, okay, I'm not really thinking, writing, all of that. Why is that so important?
So it can get overwhelming in the hospital. So whether you're the patient or you're the doctor or the nurse, there's a lot going on in the hospital. And things can get missed. We're all humans, so but we try to put processes in place. There's a lot of technology involved in the care of the patient, electronic medical records, etc. But communication is key, especially because when the average stay in a hospital for a patient is 3 to 4 days, the most of your care happens after you leave the hospital. So people should understand what happened to them in the hospital, and that transition from the hospital to the outside should happen, is critical to the care of that patient.
Okay. All right, and I think my final question, when it comes to this new specialty, hospitality, it's pretty new, is that correct?
Hospitalist.
Hospitalist.
Yes. Very new.
Excuse me,
No, that's
hospitalist.
okay. Yeah, it is new. Yeah.
So just talk to me about the emerging trends that you think you're going to be seeing with hospitalists and how this is going to affect patients and the healthcare system in general.
Yeah, so for us at Jefferson, we want to innovate everything that we do when it comes to patient care. And innovation doesn't just happen with technology. It's the way innovation happens at the front lines, the way patients are cared for, the process that they go through, even the note-taking process. The boards, the way we have whiteboards in every patient room, setting expectations for a patient. So innovations happens by continuously improving what you're doing. A lot of times people only think of, innovations with technology. So we have that. For example, at Jefferson, we're implementing telemedicine a lot. And we use like a FaceTime type technology where if a family member of the patient's is, let's say, in another state and they want to communicate with the doctor, we can use that technology right on the patient's bedside. FaceTime, it's a secure platform so that, nothing gets hacked, and then you're communicating with the family in Arizona or California or Florida, and you have the patient in the bed here in Cherry Hill with the doctor at the bedside.
Wow, that's pretty cool.
So yeah, so those are things that are happening in healthcare. And then there's also a model of the hospital at home that's being studied nationally. At the VA, for example, they're looking at if we provide the services that a hospitalist or a hospital provides in the confines of the hospital, can we do some of that at home where it's more comfortable for the patient? So it's an exciting time in healthcare with implementation of technology, changing the way we deliver care.
Yeah, very exciting. And, as we wrap things up, is there anything that you think patients watching should know when it comes to hospitalists and the role that they have or the care that they should receive?
Yeah, so I tell my patients all the time, I'm like your family doctor in the hospital. And I think patients can relate to that. It's my job to communicate to your family doctor and ensure that you continue the care that you received in the hospital. So I think communication is key, writing down everything, and ensuring that your hospitalist is communicating with your family doctor is also important. So, and then after the communication happens, that you take all the proper documentation with you to your family doctor. That's why there's an advantage that if you're within a health system like a Jefferson, if our electronic records are communicating, I know what your family doctor gave you in the office, I know what I'm sending you home on, and that communication is critical. Yeah. But hospitalists are specialists, just like other doctors, for care that happens in the hospital, and they're really like your family doctor for that short period of time.
Okay. Well, thank you so much for joining us today. I really appreciate it, and I think it's just an important conversation to have, and hopefully our viewers will learn something from it. So thank you so much for joining us.
Yeah, thank you.